Module 5, Pediatrics. Question number 1. Most common congenital abnormality of the superior vena cava is double superior vena cava. Question number 2. In moderate to mild to moderate hypoxic brain injury, a full term neonate typically spares deep gray matter structure. Mild to moderate hypoxic injury. Question number 3. Boy with progressive deterioration of vision, loss of hearing, optic disc pattern, and ataxia, mental deterioration, stereosymmetric rodentity in the occipital temporal white matter, with thin curvilinear enhancing rims, most likely diagnosed adrenoleukodystrophy. Now, it is low density in the occipital parietal region, with thin curvilinear enhancing rims, so diagnosed adrenoleukodystrophy. Question 4. Absence of which indicates a diagnosis of Danny Walker 1 variant rather than Danny Walker malformation, enlargement of posterior fossa. Enlargement of posterior fossa. Question number 4. Enlargement of posterior fossa. Okay, enlargement of posterior fossa. Question number 4. Let's see. Enlargement of posterior fossa is seen in Danny Walker variant. Correct. Which is a feature of 15-year-old boy with juvenile angioperforma, widening of the superior orbital fissure. Is a feature of 15-year-old boy with juvenile angioperforma. Question number 6. Which is the cause of widened sutures rather than cranocystosis? Cleidocranial dysplasia. Cause of widened suture. Question number 7. Which is the cause of vermin bone osteogenesis imperfecta? Shows vermin bone. Question number 8. Which is the cause of hair on end appearance of the skull? Neuroblastoma. Shows hair on end appearance of the skull. Question number 9. Cystitis is considered best answer regarding cystitis. Decreased marrow intensity on 2 consecutive vertebrae on T1 MRI is characteristic. In cystitis, decreased marrow intensity on 2 consecutive vertebrae on T1 MRI is characteristic. Question number 10. Eccentric mass expand the cord mass is isodense on T1 and hyperdense on T2, with most common intramedullary neoplasm in children. These features, astrocytoma is seen in children, ependymoma is seen in adults. Astrocytoma is seen in thoracic spine, and ependymoma is seen in cervical spine. Question number 11. Female newborn with sarcodic mass, MR shows lobular with well-defined margins and heterogeneous signal on T1 with higher signal and intermediate and lower signal areas, most likely diagnosed sacroiliac teratoma. This is sacral mass and mass and sacral in female newborn. And then heterogeneous signal on T1 and high intermediate and low signal on as areas on T2. Question number 12. Anterior hemispheric fissure adjoining a high-riding third ventricle and large prominent mono and sunburst chiral pattern. Interhemispheric cyst is also seen diagnosed agency of corpus callosum. High-riding third ventricle, agency of corpus callosum. 13. Most common site of metastatic spread in medulloblastoma is subarachnoid. Metastatic spread in medulloblastoma is subarachnoid field. 14. Which favors choroid plexus rather than germinal matrix hemorrhage? Tapering towards cardiothalamic groove is seen in choroid plexus rather than germinal matrix hemorrhage. Question number 15. Again, neuroblastomas. Enthesioneuroblastomas is very malignant tumor arising from olfactory mucosa. Question number 16. Neuroblastoma in the right adrenal with metastatic spread to the liver, bone marrow, and skin. What stage? Stage 4S, because on both sides of the diaphragm. Metastatic spread is seen in stage 4S. Metastatic spread to liver, bone, and marrow and skin of neuroblastoma is in stage 4. Question number 10. Which is the feature of Olliers disease rather than Maffucci syndrome? Absence of hemangioma is seen in Olliers disease. 18. Which is the case of alternating resolution and dense metaphyseal band? Osteoporosis is case of alternating resolution and dense metaphyseal band. 19. Child with short stature, decreased intraocular resistance, progressively smaller and lower lumbar spine, bullet-shaped vertebral bodies, and short white iliac bones, and kyphus scoliosis, most likely with achondroplasia. All these features are seen in achondroplasia. Question number 20. Known mucopolysaccharidosis, anterior beaking of the mid-vertebral body, most likely diagnosed Marquis syndrome. It is MPS 4, type 4. Anterior beaking of mid-vertebral body, Marquis. Question number 21. In development dysplasia of hip, ultrasound in the modality of choice in parents of less than 3 months. In DTH, ultrasound modality of choice in less than 3 months. So, in 22, which pattern of disease suggests PAEDS disease, then slip upper femur epiphysis, subcortical lucency and filtering of the epiphysis fragmentation. Shows PAEDS disease rather than SUFE. This shows subcortical lucency and filtering of the files means there's fragmentation. So fragmentation is seen in vacancies of the epiphyse. 23. Which are amino characteristics of juvenile dermatomyositis? Foci, growth signal, and origin are seen in juvenile dermatomyositis. The juvenile dermatomyositis, correct? Question 23. Juvenile dermatomyositis. Question 24. MR features of rhabdomyosarcoma are high signal and short STIR sequence. Rhabdomyosarcoma shows high signal and stir. 25. Factor 3 epiphyses, growth carrier and metaphyses of the distal tibia and associated soft swelling. Which solid Harris factor is this? Depth type 4. Through all epiphyses, metaphyses, and distal tibia. Type 4. Question 26. Which has the highest specificity for non-incident injuries? Scapular fracture is non-incident injury. Question 27. Most common location for congenital lobe hyperinflation is left upper lobe. Is seen for congenital lobe emphysema. Question 28. Series of variably sized cysts in the left lower lobe, which are measuring 3 cm multicystic mass of pulmonary tissue, regarding congenital pulmonary airway malformation, which is obviously correct, represents type 1. Okay, because it is cysts are up to 3 cm. In type 2, congenital pulmonary airway malformation, CPAM, their cysts are 0.5 to 2 cm. But type 1 shows cysts up to 3 cm. 3 cm cyst and CPAM is type 1. 0.5 to 2 cm cyst type 2. 29, which suggests intralobar rather than extralobar sequestration, congenital anomalies in 15% in intralobar and more common in extralobar. I think about 25% in extralobar congenital anomalies. 30, regarding congenital diaphragmatic hernias are associated with pulmonary hyperplasia. 31, Scimitar syndrome of Chester would show radiographic feature similar to atrial septal defect. Scimitar syndrome similar to AST. 32, an acanonic child with an enlarged heart and enlarged main pulmonary artery, which is diagnosed with ventricular septal defect. Enlarged heart, enlarged main pulmonary artery is seen in PhD. An acanonic child, acanonic heart disease. 33, Currarino's triad is associated of anomalies including anorectal malformation, lumbosacral anomalies, and which presacral mass. Currarino's triad shows anorectal malformation, lumbosacral anomalies, and presacral mass. 34, which is most likely to be a feature of an enteric duplication cyst, layered ecogenic depots within cyst enteric. No other feature makes any sense. Duplication cyst shows layered ecogenic depots within cyst. Option A, multi-local nature, this is wrong. B, hypovoic internal layer, this is also wrong. C, ecogenic outer layer, this is wrong. And dense classification also not seen. 35, most common location for enteric duplication cyst is ileum. 36, most common type of transition between affected aganglionic and normal ganglionic bone and hip disease is short segment. 37, most common type of tracheoesophageal fistula is esophageal trachea and proximal atratic portion and location of fistula. Esophageal atrasia and proximal atratic portion and location of fistula. 38, ultrasound feature of pyloric stenosis is elongated pyloric channel greater than 16 mm. 39, most specific radiological sign in the interventional of interception in a 6-month-old child, soft ear mouth with congenital lucency is shows interception. 40, in biliary atrasion ultrasound and ecogenic triangular cord sign represent a fibrotic remnant of the common duct, biliary atrasia. Triangular cord sign shows fibrotic remnant of the common duct. 41, which occurs with cardiac disease to form Cori syndrome, hepatic fibrosis. 42, 6-year-old girl, ultrasound of 10 cm mass in the right lobe of the liver of a reduced detector but predominantly disordered. A spoke wheel appeared on the scene due to the fibrous separated ring from the central hub, most likely diagnosed hepatoblastoma. In liver, spoke wheel appearance mass is hepatoblastoma. In the kidney, spoke wheel appearance is seen in oncocytoma. 43, regarding imaging of duplicated kidneys, duplex kidneys may have more than one renal artery and vein. 44, regarding posterior radial valves are associated with vesicular reflux. 45, normal ultrasound, neonatal ultrasound, so kidneys are enlarged bilaterally, cysts are not which are less than 1 cm. There are focal rosettes of radiologic and interlayered collagen tubules diagnosed autosomal recessive polycystic kidney disease. Obviously in baby, autosomal recessive polycystic kidney disease. 46, common feature in mesoblast nephroma, polyhydramnios in pregnancy. Mesoblast nephroma, polyhydramnios in pregnancy. 47, nephroblastoma, Beckman-Friedman syndrome, chromosome 11 anomalies, and trisomy 18 are all associated with which of the following? Williams tumor. Remember, Beckman-Wiedemann associated William tumor. W for Wiedemann, W for William tumor. 48. Human infant or sound is well-defined fluid-filled cavity between the bladder and rectum with some debrief but no increased vascularity. Uterine distension, ectopic debrief within vagina, ectopic debrief within vagina, and a noted diagnosis hematometrocolpus. Hint is that there is echogenic debrief within vagina, so hematometrocolpus. 49. Where is the feature of neuroblastoma? Large hypoechoic mass arising in the suprarenal region. Neuroblastoma in suprarenal region, large hypoechoic mass is neuroblastoma. 50. Calcification in most cases on CT. Okay. Other option is calcification in most cases. These are all wrong. Feature of neuroblastoma, large hypoechoic mass arising in suprarenal region. 50. Child with Wilm tumor and has acus of thalamus, microglacia, and gigantism and hepatomegaly, which is diagnosed trisomy 18. Wilm tumor plus exomphalos, microglacia, gigantism, hepatomegaly, diagnosed trisomy 18. In the next chapter, Barrett.